Hi, I'm Virginia, and welcome to the Health Creators Podcast, where we talk about the impact and business of being a health creator. Here with me today is Dr. Sapna. Thank you for being here today, Sapna.
Hi, Virginia. Thank you for having me. I'm super excited to talk about all things health content creating.
Okay, so let's get started. Who are you and what do you do?
So I'm Dr. Sapna. I'm a GP registrar. I create content mostly about skincare and dermatology just because it is a huge passion of mine for as long as I can remember. And I started creating content probably about 3 or 4 years ago. And I basically progressed myself from making short form content to now making much more long form videos.
Amazing. So you said a little bit about why you start creating health education videos because you love the topic. So why do you create them on YouTube specifically?
I guess I felt like YouTube is the platform that has given the most back to me. I initially was really scared of content on YouTube just because it's long form content. I hadn't done that sort of thing before, and I felt like in long form content you can be a little bit more vulnerable than short form content, and you're kind of expected to say a lot more and give your audience a lot more information. So initially I was a bit nervous about it, and I put it off for ages. And then a friend of mine basically just said, "Oh, bite the bullet and do it." And then the minute I started on YouTube, I realized that the platform itself gives a lot back to you in terms of the analytics, in terms of the team, a massive benefit from having the whole YouTube health content creating like team community. And I felt like all of that feedback definitely spurred me on to carry on YouTube. And I realized I actually can make the most impact, have the most long-term content that's going to stay evergreen on the platform, all on YouTube, that I didn't feel like other platforms were giving me.
Amazing. That's really cool. So what other platforms were you using before that you kind of left behind?
Yeah, so I initially started on Instagram, and I think a few years ago, I think Instagram was where it was at, and that was the content that I was consuming the most. So I felt like that came most naturally to me. At that time, I wasn't really on TikTok, so I didn't know what TikTok was all about, and I didn't consume as much YouTube as I do now as well. So I felt like people my age, and I realized that I wanted to target people like myself who kind of had issues with their skin, were interested in more. And I thought that all those people were only using Instagram at the time. And I think I realized that actually people consume information from all over, and that's what's more powerful as well. But yeah, I
Amazing.
moved away from Instagram just because I felt like I wasn't really growing on there. I wasn't really getting much back from it. And I've had far more growth on YouTube in a much shorter time. So for me, that's where I'm focusing my efforts.
Awesome. Awesome. So what is your process to creating health videos?
For me, I try and create two types of videos on my channel. One of them is more sort of commercially focused, and I'm looking at products that people are using the most, things that are new, things that are popular. And the other half is trying to keep things very scientific. So I do try and bridge that a lot as well. So, for example, I'll spend a lot of time in script writing, trying to make sure I'm researching something from both perspectives. And I think that's what makes my videos quite different to other people's. So I spend a bit of time on PubMed, for example, looking at a particular skincare ingredient. And this is where most of my time goes, and it's all in the script writing process. I think I'm trying my hardest to focus on making medically correct, informative videos, and I want to get that right in the script. The actual process of speaking to the camera and chatting is quite fun for me. And the same thing with editing. I think I've learned a few new skills in editing now, and I do it all myself. And that just, and for me, that's really interesting, and I quite enjoy that. So I hope that answers the question.
Yeah, amazing. So I guess part of the question as an extension to that is, do you have a schedule for how often you post? Um, do you post weekly, monthly, and how do you
Mm-hmm.
decide where you get your ideas from in order to create a video?
So I do try and be consistent with myself. I'm trying to create a video once a week, and I do try and bulk film some of them. So, for example, I did a series on empty products that I had over a long period of time when I lived in Australia. So I actually filmed about 4 or 5 videos on one day, and then I've slowly been editing and release them kind of on my own schedule because I do have a full-time job, so I am busy working. So I'm trying to integrate creating into that, and that can be a bit of a challenge. But the only thing I'd say is not to put too much pressure on yourself. I think once a week is a really, really tough target, and there are definitely phases where I haven't been so consistent. And I think if you set yourself an upper and a lower kind of limit that you're trying to aim for, so I'd say a minimum of once a month and a maximum of once a week, I think that gives myself quite realistic targets, so I don't beat myself up if I'm not sticking to that once a week target. Makes me feel a bit okay that I've still got a video coming out once a month, and the bulk filming helps support that. Even if I don't necessarily have time to edit them until a bit later, at least I've got it all ready to go whenever I need to. I think for me, it's really easy because everything about skincare and derm is things that I genuinely love. So if I am looking through Instagram or LinkedIn, or if I'm looking through Instagram or YouTube or TikTok and seeing that there is a question that I feel is unanswered, I know that I could be someone who answers that question. And I feel like like I said, I feel like I'm in a unique position where I'm a consumer as well as a medical professional, and that makes me an interesting person to watch. And I know that, and I think that's the value I can add. So yeah, that's where I kind of get all my ideas, because it's all the stuff that I would want to know, all the stuff that I love to know about. And I think that skincare and dermatology is such a huge industry that there are so many people like myself who just love it and want to know more. So I think it makes it easy that I'm actually like all consumed in this niche.
That's lovely to hear. I think if you love talking about something, then you can make loads of videos. And also, if your niche, if you like, is constantly coming out with new products or new variations of
Mm.
things, or things are being discontinued, and then you need to find an alternative, then you will become that source of knowledge and authority because you build up this backlog of all the other things that you've previously spoken about. And it's kind of like how social media is ever evolving, but so are skincare products all the time. And so it's always exciting when you're one of the first people to make a video about something, but also more importantly, from a healthcare professional's point of view. So, how did it feel to get the from a licensed healthcare professional in a UK badge on your YouTube channel, as you've got that recently, and you've also just hit 1,000 subscribers as well? So, congratulations.
Thank you, thank you. It's insane, actually. And I think this is something that is unique to YouTube. And I think it's about that kind of reassurance that I'm doing the right things, I'm on the right lines. And I think we all, and especially creators, when you're putting yourself out there and you're a bit vulnerable, need that kind of positive feedback. And I think it's really hard to get that from other places. And I feel like it's just very reassuring that there is support for what you're doing, the fact that you do have this authority and that you can use it to your advantage. And I think that's something that we're quite afraid of. It's something that's weirdly like drilled out of you as a healthcare professional. I think that we're often taught to be really, really humble and work within the limits of our competence and things like that, and not to brag about our accomplishments. And I think that that's negatively impacts you when it comes to putting yourself out there on something like YouTube or even any other venture you do. I think a lot of doctors are scared to use their title and their authority. And I think that there's a really nice sweet spot where YouTube have given us that essential tick of authority, but it's very much on my own terms, where I can say whatever I want to say and I still get to use my voice and my opinions, but knowing that YouTube kind of support that rather than it being, yeah, I think it's just very much on your own terms. And I think that that makes it quite validating in some way. And I really, really am grateful for that.
I really like the way that you express that, because I think it is really easy to kind of hide behind how much you have achieved, when actually sometimes it's really good to stand back and be the person shouting about yourself and saying, I'm a dermatologist, I've practiced X number of years, here's my professional opinion, here's the evidence that supports that, and here's the other evidence, for example, that might be opposing that, but this is why that might not be that credible, or so on. It's about being the person that connects the science to the general audience, so that they can understand and make a decision for themselves with the information that you've presented.
Mm-hmm.
And so it's really great that you're doing that on top of your job. So what kind of impact have your health videos had so far, so on you, but also on the audience that you're creating them for?
Yeah, that's a good question. I think that dermatology and skincare is a very, very interesting industry because I think it's one of the few healthcare specialties that has a massive crossover from primary, secondary healthcare, as well as all the way to commercial and beauty products and industry. And I think it's because of that, that as a consumer, which is everyone ultimately, I think everyone is a consumer of this industry, it's really hard to know who to trust, where you can get that real, factually correct information. And I myself, before I started, was just sick of seeing that space dominated by people all on the beauty and commercial side of it. And I thought that there was a really big I think there was a really big opening for somebody to be placed right in the middle of it. And especially someone like myself who is a consumer. I have my own skincare issues and suffered with acne a lot as a kid. I know that I myself and loads of other people like me needed that information because I felt like it wasn't there. And I think that as a GP registrar myself, I know I'm going to see lots and lots of patients with skincare issues, and I think being able to point them in the direction of these sorts of point them in the direction of this kind of information where it is crossing over the commercial and medical side of things. I think that that's almost invaluable because that's what patients want to know. They want to know what they can do for themselves for their issues. And I know that from my own experience. I know that I'm building an audience that was basically me from 10 years ago. And I had this amount of disposable income and I just didn't know where to put it in and to put it into the right places. And at that time, I didn't feel like my doctor knew, but they might be prescribing you something. They might be prescribing me something for my acne. And there was just such a big gap in my knowledge. So I think that for me, the biggest impact I know is catering to that gap. Um, yeah, because I think that there's just so many people out there, whether it's teenagers, adults with any kind of skincare issue. I know that there is a gap in their knowledge that can be bridged.
Great. So, have you had any comments on your videos which have said, thank you so much for creating this video. It's really been helpful. Do you want to talk about some of those?
Yeah, I think for me that's probably where you see the most direct impact from your audience, and I see it from the fact that my audience is growing as well. I know that people are interested in these topics, and people have said to me that, oh, I have this issue and I didn't know what to buy, and now I've watched your video and now I know how this particular brand or ingredient can help my skin, and I've started to see results in it. And I think that for me is very much I think that for me is very much reassuring and validating that I know people are consuming my information and trying to make better choices for themselves from that. And I think that it's a very nice sort of personal, validating feeling, much more than any particular numbers can do.
So, how do you kind of handle the commercial side? Have any brands kind of approached you to work with you? How have you handled those conversations, kind of moving more into the business side of being a
Mm.
creator? Because some people, when they watch healthcare professionals, they think, oh, they're only promoting this because they're being paid to talk about it. So, the conflict of interest and the kind of, you know, the almost tug of war between, do I really want to talk about this or am I being paid to talk about this kind of scenario? So do you want to kind of explore what your experience has been?
Yeah, I think my content is very different to other healthcare creators because my niche is dominated by medical and non-medical brands and creators and those kinds of spaces. So actually, I think it is very important to create balanced content. I think it'd be silly as a health creator to not mention all the stuff that's available over the counter, all the brand stuff, because that's the stuff that patients are seeing. That's the stuff that's created for them. So I think often as a medical professional, we're kind of told to avoid a lot of the commercial side of things from our clinics or what we're taught in medical school and things like that. But I think in this space, it's really important that I did lean into that. So I think that has obviously brought on conversations with brands and partnerships and things like that. I think that what I try and do is remain like entirely balanced in what I create. So I have organically made loads and loads of content about loads of different products and that's genuinely stuff that I've used, I've loved. And I think that my audience can see that. And then if I am creating any particular sponsored videos, I've tried my best to collect the information around that particular topic. So, for example, I have a video about LED masks and LED devices, which is huge in skincare right now. And I think if I had avoided working, sorry, so I have created, so recently I created a video about LED masks and LED lights for skincare, which is huge in that industry right now. And I think what I try to do to create the most balanced video is give an opinion that only I can as a medical professional. And that is going through PubMed, understanding all the data, going through the trials, and presenting that information so that my audience can see that in more easy to digest information. And I think that that's my way of putting my own medical spin on things that are very commercial. And I think that that's for me, the target of, so I think that for me, that's where I'm putting my special interest, my background, my expertise on a particularly commercial side of skincare. Hopefully this makes sense.
Yeah, I think, like you've said, you can't just blindly start talking about something without doing your own research first, because obviously anyone that is trying to get you to promote something, they're very pro their own product or their thing. So you need to go and dig up the information yourself almost. So you kind of have to take that into account in terms of the value that you will be bringing to that video, and also
Yeah.
informing your audience, because you have to make sure, like you said, give a balanced view and also give an honest view as well. And if you've personally used the product, then you're saying that in the video, that this is, your experience is quite anecdotal, but then also people want to know what your experience was, because I think, especially with skincare products, you can't really try before you buy. So you're very dependent on reviews and people's experiences. And we all have different skin, and it is very much trial and error to try and find the thing that works well with you. So people try to relate to someone like you. And obviously there's that trust that they're placing in you because you're a healthcare professional. So you're not trying to really sell anything to them. You're trying to just inform them.
I think one thing I've learned is that you have to kind of lean into what your audience want to hear. And my audience is searching all these very, very commercial products. And I think it is important for me to lean into that. And that means creating content about things I am not taught in medical school, but I know that I can apply my principles from my experience and my expertise to these commercial things. And I think that that's what the industry, and I think that's what the audience want to hear about. So I think it's really important to embrace that and see where it takes you.
Yeah, I love that. I think that's also really unique to YouTube, that you get in your YouTube studio a collection of search terms that your audience is, looking for all the time. And I don't really think I've seen that on any other social media platforms. So the amount of kind of intelligence you get, I'm going to call it YouTube intelligence. So we call it YI. Is really unique to YouTube, and that helps you give your channel more direction. So thank you for mentioning that. It's a really important point. So, what are your top tips for health creators who want to get started with their own YouTube health channel, or just creating health videos in general?
I think it's the same as what probably everyone says it, and it is just getting started. I think that you underestimate how hard it is to press record and actually just get on with it. And I think people avoid just doing it, and they don't realize why they're blocking actually just getting on with it. And you'll make loads of excuses in your life, but actually all you need to do is just get on with it, press record, start filming. For me, I think a easy way around that is to start filming short form videos first, and that way you can see how you feel in front of a camera before you put yourself down for filming a 10-15 minute video, because that can be quite overwhelming. It's quite a lot to get all that information down, and you don't know how you're going to feel in front of the camera. So starting with short videos is probably a good place to go. Like I said, I actually started on Instagram, and that definitely gave me a lot of confidence. So then by the time I got to YouTube, I had already polished how I was going to set up my videos, how I spoke, my own sort of demeanor around videos, and what felt most comfortable to me. And ultimately also just helped me know which direction I wanted to go in. So yeah, start small, and then you can build yourself up, because you don't need to go straight into a really, really long video. And I think that you really, really want your first video to be the one that hits 20,000 you really, really want your first video to be the one that hits 20,000 views and things like that, but it probably won't be like that. So getting started with something small can build yourself up to those big videos that are going to do really, really well. Yeah, I think that I think the other tip I'd say is to lean into what you know. Like I said already, for me, I know all about skincare and derm, and I know that that's the direction I want all my content to go into. So I lean into the things that I'm interested in, things that I'm intrigued about. For example, I made my snail mucin video, and it is the best performing video I have. And for me, I knew that I was intrigued by it. It was a hot and trending topic, and I put my own medical spin on it. And I think that that's what is most relatable as a creator. I think that's what your audience want to see. They want to see your own personal spin on what's going on, what they're interested in. And I think that people underestimate how much your own passion shows when you know that you're talking about something you're interested in. I think that that's the kind of direction I'd say for all health creators to go into.
Amazing. So that's fantastic advice. First of all, thank you very much. So everyone listening, do just get your phone out, your webcam out, your camera out, and press record. I think that's a really great piece of advice. And also, don't put too much pressure on yourself to try and create the next David Attenborough documentary that's going to be aired to millions of people on the BBC. So less pressure, but also I think you need to have confidence in your own knowledge as well. I think that if you've been practicing, you've been having these personal conversations with your patients for years and years, then that should give you the confidence that people already trust what you have to say, and just you're basically just doing a recorded version of that. So I guess a really great question is, what have you bought recently to add to your kit?
Oh, I've recently decided to invest in a softbox, which I have like right here. I think that that's massively changed how my videos appear. Prior to where I am now, lived somewhere where I had an amazing backdrop, and unfortunately, I don't live there anymore, which meant that I felt like I was starting from scratch with regard to that. So I invested in a couple of lights. I've got this LED light behind me that changes color. I can demonstrate that if you're interested. And then, and those are the two new pieces of lighting equipment that I've got. I still use my phone to film everything. I've got a iPhone 13 Pro Max, and the cameras are more than enough. So actually, I'm not looking to invest in camera equipment just yet. I don't think I need it right now. I'm pretty happy with the quality of the videos I'm getting, because having sufficient lighting really, really helps. And I think for me, it's just about creating like a setup that displays what it is I'm talking about. You can see I've just got all the products that I have on the go right now, and these are things that I'm using organically. And I think it's quite nice to be able to display what it is you're talking about in some way. So for me, this is the setup that I've kind of invested in. And all of these things were pretty cheap off Amazon, nothing too expensive, because I appreciate with things like lighting, there is a massive scale. You can spend 30 quid on Amazon, and you can spend hundreds from professional lighting companies and things like that. But I think it's just about starting simple, and you can always upgrade your equipment as you kind of go along your journey. I started off with just a ring light, and then now I feel like I have the time and can invest in something a bit bigger. My softbox probably cost about £70, which isn't too bad compared to how expensive lighting can get. So for me, I know that I'm happy with that. I think it's just like not overthinking what you invest into, really.
Yeah, I love that. And I think also you can get really overwhelmed about startup costs and things, but actually you've got the thing that you need the most, which is your phone and or your webcam if you're filming on a laptop or something. And also, you know, the most recent Apple event was filmed on iPhone, so there you go. Even they don't have a professional camera, and so you know that should give you more confidence to just get your
Mm,
phone out and film yourself. And you know, you don't even need a tripod. You can balance your phone on some books or something.
literally.
Yeah, exactly. I'm
And
glad you.
just there's so many good YouTube videos about how to create a very basic setup. And that's probably what I did when I first started, of just how to make a video. And you can just see all the simple things that you can invest in or not invest in, and work from what you have. And there's basically a video out there for every single budget, so you can figure out where you lie. And I appreciate that because, especially when you're new to it, you don't want to necessarily put all your eggs in one basket. So you're nervous to purchase things because you feel like you might never use it. And you kind of want to get that positive feedback before you go in and spend loads of money. So yeah, figure out how much you're willing to spend, and you can always find something literally in every spectrum.
Yeah, fantastic. So thank you so much for chatting today, Sapna. And I'm so excited to see where your channel goes. Are you kind of, what are you working for? What are you working on right now? And what are you hoping for in the future?
I guess right now I've literally been creating a video about heat rash. I actually had a short form video that's done really well on YouTube, and that's prompted me to create a long form video. So I guess that's another tip as well, to like lean into the things that are doing well and figure out where you want your next video to go from that. So yeah, I've literally been working on that video today. And then moving forward, I guess I just want to continue to be consistent, because I realize all the opportunities are kind of out there and they're coming towards me as I become more and more consistent on the platform. So yeah, you have no idea what lies ahead, as cliched as that sounds.
And what lies ahead, hopefully, is always going to be very exciting. so, so thank you so much. And thank you so much for watching or listening today. And we will see you at the next episode. Bye.
I think it was, I think it's, yeah.
I think that's really great. And
Sorry,
I
I'm a
like
bit
the.
rambly.
No, that's fine. We've got half an hour. um, so I was gonna say that it's a really nice way. I'll say again because now I've lost my trail of thought.